Perfect. Okay, thank you so much for joining, everyone. I know you guys are super busy, so we really appreciate your time this evening. As you'll already be aware, the focus of the webinar today is on heavy menstrual bleeding, what it is, the impact of it, and how we might treat it in pharmacy. Just by way of introduction, my name's Izzy Parry and I'm the brand manager for Evana and Ultravana, the products we'll be touching upon today. But you'll be pleased to know the majority of our discussion will be led by Serena. I will just let her do a quick introduction herself.
Hey everyone, thank you so much for joining. My name is Serena. I'm Serena Mughal. I'm actually a portfolio pharmacist. So by title, pharmacist for about 12 years now. I'm the director at Harrods Pharmacy. I've also got my own aesthetics clinic. I'm a consultant, I'm a trainer, I'm an educator. I'm also a specialist in the medical cannabis field and do a lot of portfolio and media work. So today, as Izzy said, we are discussing a very important topic. And sometimes I feel like women's health often gets overlooked. So it'll be a very interactive session. So feel free to jump in, ask questions as we go along.
Perfect. Thanks, Serena. So just to really briefly outline what we're going to cover, obviously the welcome and introduction, that's now. Serena's then going to cover heavy menstrual bleeding itself, kind of the therapy area, what that might look like in a bit more detail. She'll then touch upon Evana specifically. And for those that don't know, Evana is the first kind of over-the-counter version of tranexamic acid that can be sold in pharmacy and bought without a prescription. So she'll be touching upon that and what that means for your role in this sphere. She'll then dive into some patient case studies. And again, we want that to be a really interactive session. So looking at hypothetical scenarios in which you may or may not want to recommend a treatment for heavy bleeding and Evana specifically. And then lastly, we'll just wrap up with your guys' questions, thoughts, reflections. If there's chance, there's a couple of things we might want to ask you guys and get your feedback on. But that's kind of what the session looks like today. And roughly it's going to take us up to about 10 to 8. And then we'll let you get on with your evenings. Really quickly, I just wanted to touch upon who we are from our end. So Evana's parent company, Maxwellia, specialises in this switching process. So taking prescription medicines and making them available to buy over the counter. So as I've touched upon, that's what we've done in the case of Evana with tranexamic acid. Ultravana for period pain relief, it is naproxen, switched to OTC. And then kind of looking a bit further back historically, we also one of the first companies to switch the contraceptive pill, the mini pill, and we also have an accessible emergency contraception tablet in the form of Lovey-1 as well. So we're female founded, you know, our founder Anna is a pharmacist herself, so she knows what she's doing, she knows what she's talking about. And on behalf of Anna, you know, we're really delighted to kind of bring this to you today and discuss these products in a bit more depth. Having said that, I'm now going to hand over to the real expert, Serena, to take it from here.
Thanks, Izzy. So welcome everyone. As you know, today's topic is specifically heavy menstrual bleeding, but I just wanted to touch initially on some key statistics about the actual sector. So as you can see, it's actually quite unfortunate with women's health. It sometimes gets left into a corner. It's quite a taboo topic, whether we're discussing menstruation, menopause, hormone replacement therapy. But however, now I feel like there's a lot more light being shed on women's health, so that's fantastic. 1 in 3 women actually suffer from heavy periods, what they describe as heavy. 71% of women actually report period pain, and this is across the spectrum. There are statistics showing that some women's period pain is so severe, it can be almost as severe as having a heart attack. So think about us when we're going through our periods, guys. And even in terms of hearing concerns and women raising concerns, around 51% of women actually feel like their concerns aren't being taken seriously. And that's not to say it's because of the healthcare professional or your GP, it's whoever they're talking to, they feel like it's not being taken seriously. So I think this opportunity to shed light on this topic is super important. Obviously, I'm assuming you're all pharmacists on this call, so it is a great CPD opportunity as well. So as Izzy mentioned, there are 2 brands. We actually stock these brands in my pharmacy that I work in, and a lot of others that I've actually locumed in the past or managed. Evana is actually tranexamic acid, 500 milligrams. It's available in all pharmacies from various distributors, and also Ultravana, as Izzy mentioned, is naproxen, 250 milligrams, which is great for period pain relief. Now onto heavy menstrual bleeding. So as I mentioned earlier, this session, I'm more than happy for you to put comments into the chat. A lot of the slides you might see blank because I'm waiting for you to sort of jump in and we can have a discussion. So there is actually a definition from the NHS about what heavy menstrual bleeding is. Now, has anyone ever come across this, or can anyone shed some light on what they think can be defined as heavy menstrual bleeding? Okay, everyone's a bit shy. Okay, so according to the NHS, the official definition is women who lose more than 80 mils of blood every month is considered heavy menstrual bleeding. But in reality, how many of us can actually measure that? It's very difficult to. So from a scientific and clinical point of view, there are some actual different ways that you can define that. So it would be a case of if you are changing your pad or tampon every 1 to 2 hours, which is quite a lot. So imagine throughout the whole day, even if you're needing to double up with your sanitary products, especially even if you're getting blood clots that are larger than practically a 10p piece of coin. And these are sort of great ways to highlight how you can actually define heavy menstrual bleeding when you have a patient in front of you. No one's really going to say to their patient, do you have heavy menstrual bleeding? It's a taboo topic. People may not want to have these conversations on your counter. So therefore, there's ways that one of the points of today's session is that there's ways we can actually ascertain from the patient through certain conversations and consultation skills how they are experiencing their periods, because they may also not realize that they are going through heavy menstrual bleeding. So a good way especially would be the 10p coin, blood clots, and if they're changing their sanitary products quite frequently. Now, the impact of this to some women is actually debilitating. I know several patients I've had of my own who unfortunately sometimes can't get out of bed with heavy menstrual bleeding, because it's not just the bleeding, it's sometimes pain associated with it. It's the fact it can affect their daily lives, it can affect their work, their family lives, etc. So what sort of impact do you think this would have on people, in addition to some of the ones that I've mentioned?
Serena, there's just a slight lag in answering the questions. There was 2 answers through from your previous.
Sorry, I can't see that.
So Jessica mentioned that it stops you from everyday activities, and changing pads regularly was mentioned by Helena. So they're just a slight lag on the question. So if you want to give a couple of seconds just post question. And no, it's fine. It's fine. I think it's just the system. It just takes a little while when people are typing in, and then it comes through.
We rely on technology so much and it can still fail.
Just while people are answering this current question, which there's a couple of people coming through now, there was a question for you, Issy. Helen asked how are medicines able to change class from POM to P?
So it's not my department, I'm going to be completely honest. I'm very much in marketing. We have a regulatory team within Maxwellia that specialise in that switch process. It's a very, very rigorous process. It can take, 5 years plus in some cases to gather the medical information to essentially prove that certain medicines are not only safe to dispense in pharmacy, but, it's actually really beneficial that we open up the gateway to do that. The reason why kind of Maxwellia is so invested in that process is to essentially, empower and enable pharmacists to help people where they previously couldn't. You guys are highly trained healthcare professionals, and there are a lot of medicines that you are more than capable to recommend and dispense over the counter without having to signpost people to a GP. So that's kind of why the process is in place. And in terms of, the process itself, it goes through the MHRA. It's very, very kind of clinically robust, if that sort of answers the question.
Yeah, feel free to kind of comment and go through the Q&A if you want to, Issy or Serena, to expand anything on this. But for answering from your question, Shariah has said it stops you from going to work, Serena.
Yeah.
So that's
I can see everything now. Yeah,
Yeah,
because this is in the Q&A section. It's not in the chat section. Yep. Perfect, guys.
You can see that
Cool.
now. So, okay.
Yeah, I can see everything. The technology caught up. Yeah, so essentially it stops you going to work. It can affect your confidence. It can even have cause a lot of anxiety for patients because they're constantly worrying about, if I'm out and about for the day, is there a bathroom nearby? Will I be leaking? What clothes are they wearing? And these are all just extra things that we have enough that we need to worry about all the time as women, as humans, really. And the last thing we want is to be stressing about extra things just to make our day a bit better. So yeah, that's fantastic. Izzy, if you could just tap the side, those answers could
We've
come up.
covered everything on
Basically, yeah.
Oh, sorry, just to double check. Yeah.
Amazing. Next slide. So some of the conversations that I want to highlight today, really and truly, when we are in community pharmacy, we're super busy. Sometimes I know in my department it's full, people wanting the pharmacist all the time, sometimes people wanting completely different things. Now, it's very rare that a patient will come in unless they know the drug already. And the whole point of today is to actually highlight Evana at how much of a great drug it is to help women. It's not everyone will come into your pharmacy and say, hi, can I get Evana? Especially if they aren't aware of the drug. They will most likely come in and they'll have different sort of questions. It's very common for patients to come in and say, look, I'm really fatigued. I'm really tired. I'm low on energy. And these kinds of points are perfect moments where you can actually intersect and say, you know, okay, do you have any particular reason why you may be tired? Do you take particular medication? Have you had a recent blood test? If you can see they are a woman of a menstruating age, you could ask, do you have particularly heavy periods? And that's how you sort of gauge in these types of conversations. Now, a good way to check also is if they are coming in and their shortness of breath. Because obviously with a increased heavy menstrual bleeding, you're going to be bleeding out a lot more, having a lot less iron. Patients who are purchasing iron supplements or who quite commonly say they are anemic, and also patients who you find are having pain all the time. When we have a consultation and a patient comes in for a pain-related medication, we all know our WAM questions. We all know to ask, who's it for? You know, what type of pain is it for? And upon questioning, you'll find out patients will tell you, oh, it's for period pain, etc. And that's when you can use these kinds of conversations to actually step in and see if you can offer them other treatments available, such as Ultravana. If they've got Ultravana for pain relief, the naproxen. If they're finding other remedies such as paracetamol and ibuprofen is not particularly working, or if you start noticing the iron supplements, low energy, fatigue, then you lead on to that conversation about potential heavy menstrual bleeding, and that's when you can interject and explain to them there is a medication called Evana.
And I think just to that point, Serena, sorry to interject.
Okay.
When patients are sort of coming in inquiring about pain, we've kind of heard from consumer feedback that they're saying pain, but the actual issue is how much blood they're losing, as you alluded to before. You know, it's kind of a twofold issue. So it's about kind of teasing out, you know, which treatment might be suitable for the person in front of you.
Also, as Izzy said, it's like you said, how much blood they're losing. And to some women, what they think is normal actually isn't. So they just may be so used to losing over 80 mils, 100 mils, 120. And to them, their whole life, since they've started their periods, may be a case of, oh yeah, it's very normal that I change my pad or my tampon every hour. When in actual fact, because that's all they know, that's not actually normal. Therefore, there is a medical definition for it. And there are medications that we can actually help give patients a better outcome and a better quality of life, essentially. There are some countries, which I think we need to put this into the UK, who actually give you time off around the time of your period. That's great. But right now, until that happens, we need to look at other measures. Okay, so some of the examples of conversations. So before we sort of give you some, what kind of examples, oh, never mind. What kind of examples do you think you could ask a patient coming in? If we were sort of to do an OSCE or like a role play, if I were a patient coming into your pharmacy and saying, hi, do you have anything for, I've got low energy, what sort of probing questions do you think you'd ask? Stevie, let me know if anything comes up on your side, just in case mine is a lag again.
Yeah, Helena said blood tests, question mark.
Yeah, perfect. So I tend to ask patients a lot of the time, have you had a blood test, especially when it's low energy? Mainly because if someone's got low energy, what do you think, I know we're talking about heavy menstrual bleeding at the moment, what do you think some of the factors for low energy could be? It could be signs for other medical conditions. So it could either be other than heavy menstrual bleeding, it could be signs of low iron, it could be signs of thyroid conditions, it could be signs of low blood pressure. So the list does go on. So fantastic if they've had a recent blood test. Let's say they say, no, I haven't had a recent blood test. Would you necessarily tell them to go get a blood test first, or and then they leave your pharmacy, or could you probe with some more questions?
There's a couple more. So
yeah, someone said thyroid. How long has it been? Is there a pattern? Fantastic. The question, that one I really like, is there a pattern? Because if a patient then says, oh yeah, this is sort of happens every month, and they may not want to say it's around the time of my period, or they may not want to discuss it, then you can say, oh, then you can probe the question and ask, is it around the time of your menstrual cycle? Fantastic. Thank you. Izzy, if you could just tap some of the potential conversations we could have. Yeah, there you are. So are your symptoms linked to your menstrual cycle? Some of the others, we touched on it slightly briefly before, but will be things like if they're purchasing an iron supplement, you can kind of check, is this something they take all the time? Is there any particular reason? One of the most common reasons for low iron is when patients have what's it called? Heavy menstrual bleeding. So if they're losing a lot of blood or they have really heavy periods, there's a really common side effect, that being you have low iron as well. So that's a fantastic way to touch on that topic as well. There's another suggestion than what we've put together that says, can I ask if you think a heavy flow might be contributing to feelings of pain or discomfort? Now, sometimes when you're on the shop floor, it's not always simple to say things like, hi, do you think you have a heavy flow? Because there could be other patients around. Obviously, sometimes patients don't want to go into the consultation room because they've come in just for some iron supplements, but you're trying to gauge what is the root cause. So just be careful with your terminology, but asking probing questions such as the flow of their periods and the frequency might help you to gather a bit more information. And then another good one is about their social activities. If they're saying to you, oh, I'm really low on energy, it's sort of happening every month, it's affecting me playing sports, etc., then you know these are kinds of probing answers to be like, okay, happening every month, affecting their daily life and affecting their social activities as well. Next slide, please, Izzy. Perfect. Now onto the main drug itself, Evana. So I'm not too sure how many of you have come across tranexamic acid. It's very common prescribed medication. Now in your pharmacies, do you usually see prescriptions for this drug quite often, or is it one that's not that common to wherever you're located? Oh, someone asked, is it normal to see more pain with more blood flow? Not necessarily. There isn't always a correlation to say the more you bleed, the more pain you're in. I know some patients who have very painful periods, but they don't necessarily have very, very heavy menstrual bleeding. So try to make sure you get the answer to both those questions to find out what's the right medication to actually offer to the patient. So as Izzy mentioned earlier on, this is a POM medication that's now been switched to a P. So that's fantastic, better access for patients. Great to see that you all have come across the drug before and you get quite a few prescriptions, but now we can actually offer it over the counter, which is better for everyone. And it's easier access for patients as well. Obviously, we know in the NHS, for example, everyone is overworked, understaffed, and sometimes patients can't always get into their GP just to get a prescription for tranexamic acid. Now, however, obviously it is a over-the-counter medication. There are going to be criteria and licensing. So there may be rare situations where you'll need to refer them to a GP, but we're going to go through those later on today. But yes, this is the main one. It's just under £15. Not too expensive in comparison to the cost of an NHS prescription. Next slide, please, Izzy.
And also the cost of all those sanitary towels and tampons they're probably going through.
Exactly. So about the drug itself, it has been around for a long time, 1972 to be precise. And statistically, these are some statistics you can actually use when recommending the medication to patients, especially if it's something new and a patient is not actually aware of it. You can use these statistics to say it can actually reduce heavy menstrual bleeding by up to 60%. And 94% of women experience a decrease in the volume of blood they've actually lost, which is huge. These are fantastic numbers, great statistics, and 83% of women have improved quality of life, which is the goal here. We want patients to have a reduced blood loss, better quality of life, and actually help them in their day-to-day activities. So fantastic statistics. There's lots of studies as well. If you want a more clinical aspect, at the end of this slide, there's a lot of reference points. So anyone who works in a hospital, maybe pharmaceutical industry, that wants a lot more detail, that's available for you as well at the end of the presentation. Next slide, please, Izzy. Okay, so it is how it works, a little bit on the mechanism of action. It's actually an antifibrinolytic drug, so it prevents blood clots from breaking down. So it blocks plasminogen from binding to fibrin, which is in a process called fibrinolysis, and therefore it blocks the breakdown of blood clots. So essentially, we want to retain the blood and stop too much flow. Thank you. Okay, so women who can actually take Evana, obviously it has to be through, if you are in a menstruating age, 18 to 45 years old, and it's people who have regular menstrual cycles. I know there's a large topic at the moment with hormonal imbalance and women's health, but please remember this drug is for women who have regular 21 to 35 day menstrual cycles between the ages of 18 to 45. Thank you. So how to take the actual medication, very similar to what you'll see on prescriptions, no more than a maximum of 4 days. Dosing 2 tablets, so 1,000 milligrams 3 times a day for as long as needed. There is a maximum that we would say no more than 8 tablets within 24 hours. That is only if your menstrual bleeding is not reduced. So it can be a bit confusing for a patient who's new to this, but please make sure you explain to them maximum of 4 days. The last point is really important, actually, because this is where you'll need to know when to refer patients and when to basically not, and when you can carry on the consultation yourself as a pharmacist. If after 3 menstrual cycles there's no reduction, they do need to see their GP, mainly because you want to make sure you're monitoring and making sure there's no other underlying cause or underlying condition that could be contributing to their heavy menstrual bleeding. Okay, patients who cannot take this. So this is technically the contraindications. Obviously, we already said between the ages of 18 to 45. So of course, anyone under 18 wouldn't be able to take it. Anyone with irregular menstrual bleeding, that's very important. Why do you think, why do you think you can't have it with oral contraceptives? Well, the answer is right there. So let's just pretend I didn't see that. Yes, it's because there's a increased risk of thrombosis. Anyone taking any anticoagulants or other medication that could interact, especially warfarin and any blood thinners. Anyone who's got renal impairment, renal insufficiency, any blood in the urine, any other fibrinolytic conditions that can basically antagonize the drug. So that will affect how it will work. Any patients who have epilepsy or a history of convulsions. And of course, if you are sensitive to the drug or have any allergies. I always say to patients, pharmacists that I'm teaching, remember, any drug that you give, always ask allergies. We're so conditioned to ask allergies only when it's an antibiotic, but we often overlook that sometimes patients are allergic to other medicines, and it's only we just don't get into that habit of asking. So it's always really good to ask these sorts of questions, and of course, if they're pregnant. Any questions so far from anyone?
There is a question in the chat Um,
In the blood loss the lining of the uterus, what will happen to the blood in the uterus? So it's basically how it works is based more on the enzymes. So the blood in the, think about it, when you're going through your cycle, you only start to bleed at a certain point in your cycle. So if you're taking this at the correct time, it will stop the bleeding as much. Remember, it's not going to stop your blood completely, it's just reducing how much. So essentially the blood in the uterus, it will still flow out, there'll just be less flow.
So it all still comes out. It's essentially
nothing gets left there. There's no leftovers. There's no pooling, so there's no risk of any cardiac issues or any risk of having any blood clots or anything staying in there. It will still all come out like it would in a normal period, but because you start taking it at a certain point when you're bleeding, it will reduce the volume of blood. Perfect. Next slide, please, Izzy. Thank you. Okay, so these are cautions. Now, remember, when we qualify as pharmacists, etc., whether you are a prescribing pharmacist or not, whether you're new in your journey or quite experienced, we have guidelines for a reason. Of course, you've got your nice guidelines, you've got your clinical knowledge summaries, but sometimes there's not always a definitive yes or no answer. Certain things are ethical dilemmas. So sometimes, I don't say take cautions with a pinch of salt. You sometimes have to make an informed decision when a patient is in front of you. And if anything, we say any patients who fall within this category, so if they're over 45, obese, diabetic, etc., me personally, I wouldn't give these patients Evana just because they need to be monitored. I'm not saying they can't have the drug tranexamic acid, but remember, Evana is a P medicine and there are licensing arrangements with it. There is a criteria for it. So it would be a case of where I would refer them to the GP so they can be monitored. Doesn't mean they can't have tranexamic acid as a medication, but they require extra monitoring. And essentially it could cause other issues, especially if they have other medical conditions. Now, it could be a case of the GP does prescribe it or they're prescribing pharmacists, etc., because they have the facility to monitor. Over the counter, unfortunately, we can't do that. Slide, please, Izzy. Perfect. Side effects. Okay, so common side effects, all the gastro ones, that's a side effect of many, many medicines. So nausea, vomiting, diarrhea, but it is usually mild once the dose is reduced. Can anyone tell me what the dose is for Evana? We said it a few slides ago, but I just want to see how much everyone's paying attention. Perfect. Thank you, Jessica. 2 tablets 3 times a day. And what's the maximum number of days you can take this for initially? Perfect. Thank you. Everyone's popping in great answers. Amazing. At least you're listening and you haven't fallen asleep yet. So I'm doing my job somewhat. Also, be careful of rare side effects. So visual disturbances, yes, they're rare, but remember with every side effect, we do have to counsel the patient correctly and make them aware of these side effects of medicines to help them make an informed decision. So make sure you explain to your patient, yes, there is a rare side effect of visual disturbances, including color vision. Some patients may experience sort of a small blood clot in the eye. Again, very rare, but if that happens, they need to know to stop the tablets and speak to their doctor straight away. Okay, so I've asked you so many questions. Who's ready for some like patient case studies now? So this will be very interactive. I'm probably going to be doing less talking. So case study number 1, I believe it is patient Emma. Yes. So 31-year-old patient. She has heavy periods. She's finding they're hard to manage. She has to take a couple of days of work each month. This could obviously cause things like more stress in her routine, loss of income, depending what she does. She's had heavy periods now for the past 10 years. 6 months ago, she saw her GP who prescribed her combined oral contraceptive. And so that's what she takes. And she has a 1-week withdrawal bleed. So do you think this patient is suitable for Evana? No. Perfect. Yes, because she is taking a contraceptive oral pill. She's not suitable. What is the risk if she took Evana with her combined oral contraceptive pill? What are we increasing her risk of? Perfect. Thank you so much. Someone said due to the risk of thrombosis. Amazing. Next case study, please, Izzy. So here we have Becky. Becky's 39 years old. She's had heavy periods after her pregnancy, and they're now having some visual disturbances, and they think it's down to their migraine, which is related to their heavy menstrual bleeding. But right now they don't have a headache. This has been going on for about a year now. She was recommended Evana 2 months ago, so she's already taking Evana, and she takes a painkiller. Do you think Evana would be suitable for her? Sorry, she was recommended Evana 2 months ago. She's not already taking it. Oh, I've got a notification that Christina raised her hand.
Possible to unmute people if they want to speak? Or
Yeah, I'm more than happy for people to jump in, talk rather than type.
Yeah, I can do that on my side, if you like.
So Sarah Jane and Nadira both said, no, she has visual disturbances. Fantastic. So we went through the side effects of Evana, and one of the rare side effects was visual disturbances. So she already has those, and she's been taking it the last 2 cycles, and we wouldn't recommend that. What would you do instead? So she's having visual disturbances. What would you tell her to do in terms of her Evana? Perfect. Refer to the GP and stop the product. Yeah, that's what's really important. So she does have to stop the medicine and refer them straight to the GP. So the next one. So Natalie, she's 28. Has heavy periods, and she's previously consulted a pharmacist before, and it's been happening for about 3 years now. She was recommended Evana 3 months ago, but has not noticed any difference within her menstrual flow, but she wants to do a repeat purchase. So even though she's come in, she's like, oh, I'm not really sure if it's working. I don't think it is. Been using it the last 3 months. It's fine. Let me carry on. Let me try again. And she takes no other medication. Would we sell her this medicine? Perfect. Yep. So thank you, Afua and Hanan. She has had it for 3 cycles, which if you remember at the beginning of the presentation, we said if you've had it for 3 consecutive menstrual cycles and there's no reduction or no improvement, then yes, they do need to stop the medicine and refer to their GP just to find out if there's anything else going on, if they need further tests, etc. Case study, please, Izzy. Thank you. So here we have Hannah. She's 36. You notice her buying several packs of super tampons and heavy flow sanitary products. No other medical conditions at all. When you ask her what are her symptoms, she said flooding, bleeding through her clothes and her bed sheets, and it affects activities throughout the day as well. For as long as she can remember, it's always been like this. So remember at the beginning, we said some patients think this level of heavy menstrual bleeding is very normal. You asked her how long has her cycle is for, and she said her periods settle into a 26 to 28 day cycle. So what's the cycle? What's classed as a regular period? What's the cycle window? We said at the beginning of this. So Bumni and Shahira, you both said 21 to 35 days. Brilliant. She's not taken any action before. She's never thought about it because to her it's just normal. All she's ever known is these heavy periods. She tries not to take anything. On the odd occasion, maybe some paracetamol if it's quite bad, and she takes no other medication for anything else. Do you think this patient would be suitable to try Evana? Perfect. Thank you. Yep, everyone's got the gist of it. Yep, she's an ideal candidate. Someone said potential irregular cycle patterns so far. She said, well, technically the patient said for as long as they can remember when their periods are settled, it's into a 26 to 28 day cycle, and the window is 21 to 35. So she is considered someone who has a regular menstrual cycle. The only variability is 2 days. If it was a case of she was having a 36-day cycle and then like a 21-day and back and forth, then that may raise an eyebrow. But yes, you can advise her to try Evana for 3 consecutive cycles because that's the maximum she can do. Obviously, from a clinical point of view, if she is in pain, because she says sometimes she has tried paracetamol. Obviously, she can try another NSAID such as ibuprofen. But if those, what would be the other potential item on your shelf from Maxwellia that you could recommend? Perfect, the Ultravana, which is naproxen. How many milligrams of naproxen is it? Brilliant, 250 milligrams. Thank you. I'm loving the engagement. I like when I do teaching sessions and everyone's actually having a chit chat rather than, it's a bit boring. Even if I'm doing in live presentations or lecturing, I will always have a chat with everyone rather than just me reading off a slide. So well done. It's 250 milligrams. Someone said 200, but it's actually 250. Next slide, please, Izzy. Okay, so here we have Maya. She is 25 years old. She gets headaches, dizziness. She's pale. She's tired, despite being inactive during her heavy period. So it's not like she's doing any excessive activity or exercise. She changes her sanitary products every hour for the first few days, and her menstrual cycle is 28 to 29 days. She's had heavy periods for quite a few years now since she's come off the contraceptive pill. And the other symptoms have been for the past few months, but it seems to be getting worse. When we asked what action has she taken, she said none. Her mum had heavy periods when she was younger, and she just thought it's something, it gets better after having children. Again, another patient thinks this is normal, totally fine. She takes quite strong analgesics, so your Solpadeine, your Cocodamol over the counter, because she tries to manage the headache several times a day, and this happens several times a week. She has no other medical conditions. Do you think she is a suitable candidate? Someone said yes. Okay, brilliant. What sort of questions? So this is quite a good case study, actually. What sort of questions do you think you could help to actually sort of link sell a product or give her great patient counseling? Because there's about 3 different things I'm looking at in here. So yes, she's suitable, but she often gets headaches, dizziness, pale, tired. So she's losing a substantial amount of blood. Do you think she could be deficient in anything else? If we're losing lots of blood, what are you also losing? Iron, perfect. Yeah, so she could be deficient in iron. So in that department, would you say to her, has she tried iron supplements, or would you refer her to get a blood test? Blood test, yeah. You can also recommend some iron supplements. However, just be careful if you don't know the deficiency of iron. Nice clinical guidelines say you can recommend ferrous sulfate, ferrous fumarate over the counter, etc. But remember, sometimes I always say to pharmacists, be careful when we're recommending iron, because iron is not a water-soluble vitamin. So water-soluble vitamins, so your vitamins A, D, E, and K, they are your, oh, that's your fat-soluble, sorry. Your fat-soluble vitamins and things like iron, you should not be having in excess. Iron in excess can also be very fatal. So we want to make sure patients are taking the correct amount. Your water-soluble vitamins, however, obviously, if you have too much in excess, they do get passed out into the urine. I'm not saying you go crazy on the water-soluble ones, but even so, just be very careful with iron. So yes, offer a blood test. You can offer gentle iron supplements over the counter. Anything else in terms that you could counsel here for in terms of pain relief? Yep, Ultravana. So she didn't say she's necessarily got period pain, but obviously upon your consultation and upon questioning, if she expresses period pain, then yes, Ultravana. But for her headaches, just cancel the patient because they're taking very strong medication. They're taking codeine-based products for headaches. So make sure you counsel them on how much codeine-based products you should take. From a consecutive point of view, how many consecutive days should you maximum be taking codeine-based products for over the counter, not prescription ones, over the counter? 3 days. Brilliant. Someone said perhaps raises codeine dependency. Yeah, perfect. Thank you. I'm just testing everyone's knowledge. This is a great CPD session. We're tapping into different areas. Thanks, Izzy. Believe there's one more case study. So, yeah, we have Lucy. Okay, so Lucy's 17. She's had heavy periods that last for 8 to 10 days now. For the past few years since she started her periods, they've started to become more regular, essentially. For the past few months, she's had 2 periods a month and experiences much more intense pain. Her friends say it's normal because that's maybe what they experience. But, you know, it's normal. It is what it is. You know, just carry on. Medication that she's tried, she finds ibuprofen doesn't last long enough, but she doesn't take any other medication. Do you think she's suitable for Evana? Perfect. Someone said no, she's under 18. Fantastic. Yeah. She's unfortunately not suitable. So you would obviously refer her to the GP, because just because we can't give it to her because she's under 18 over the counter does not mean that she should suffer. So still refer her to her GP. They may need to do some more blood tests, find out exactly why her periods are irregular. They've become more regular now, but we need to have a lot more conversations with this patient to see how we can best help them. From a pain relief point of view, she says she takes ibuprofen, doesn't last long enough. Is there any other medication you could give to her? Oh, my screen just got blank for a second. Naproxen, yeah, so Ultravana essentially. Perfect. And I think that is the last of the case studies, I believe. Is that correct?
Yes, I believe that's correct.
Thank you so much. But fire away all your questions, guys.
If someone has a question, they can put it in the chat and then I can unmute the person so they can ask directly. Is that better? Do you want to try that?
Yeah.
It seems really, yeah. Happy
Please
enough.
don't be shy here. Feel free to jump on, say whatever you need to. It's not a case of just Izzy and I yapping away.
Okay, Helena, I'm going to unmute you if that's okay, and then you can ask that question. If you're comfortable, Helena, you should now have the ability to ask that question to Serena.
It's okay, I can answer. So naproxen is given for period pain. Yes. So
sorry, can you hear me?
Oh yes, hi.
I